We are going to document and demonstrate an operative note for this patient, AJ Culp. We're going to go to the fact that he is here today for some operative treatment. The template or templates are here on the right hand side. Here's the operative note itself, and we have different options here. We have extractions with no nitrous, combinations of treatment, which is often the case of what we're doing, the combinations of treatment for older kids with no nitrous oxide, amalgams, resins, etc. So in this case, according to our treatment plan here, it looks like we have, well, let's verify, shall we? We have some red marks on the teeth. We're not sure if these are amalgams or resins. So let's go over here to the progress notes, and then we're going to deselect everything so it's not confusing, and just look at the red. And the red here is 19, 20, 22, 27 are all resins. So we know that is the case now. Instead of just red, they could have been amalgams, but now we're sure that they're resins. So let's go back over to the clinical note. We're going to go ahead and use the section of resin. This is without nitrous, so we're going to use this section with nitrous. So we're going to click that, double click it, and it always asks you who brought the child today. In this case, it was Dad. Hit OK. What is the reason for today's visit? And that is treatment for decay. TX stands for treatment. Nitrous oxide was used before administration, is typically 50%. How many cartridges of lidocaine used? Well, we didn't use any lidocaine in this case because we used articaine. And it'll always ask you both because it is typical to use both. In this case, we used a half a cartridge of articaine. And we're going to hit OK. Then we typically reduce the nitrous oxide down to a level at which, down below 50%, usually between 35 to 40, depending on the child's apprehensive level. In this case, we're going to stick with 30%. And which teeth were restored? We're going to go ahead and select after the hashtag sign, number 19. Pre-etch. Pre-etch is a standard document. SE bonding system is very standard. Resin, and then you can just include the shade. And then if you hold the left mouse key, slide it over, you should be able to right mouse click, or at least Control C, copy, and then go ahead and hit your next tooth and line, which is number 20. And then if you hit Control V, or right mouse click and paste, it should just repaste that information for you. So you can do that as many times as you need to make it easy. That's the key, right? Is accurate and easy. So you can see how I'm just knocking this out really quickly there, and it's all appropriate now. And then you hit OK. Time for oxygen. After we're finished with the procedure, we have to reverse the nitrous oxide. So in this case, we're going to use 7 minutes. Frankel score, he was a good kid, did a good job today. Additional comments. In this case, he was a very good boy. Hit OK. What's our next visit? Well, we completed all 4 resins today. There aren't any additional reds materials there, and in fact, let me just briefly back up. Let's go back to the progress notes. Oh, we can't do that just yet. Let's go back and we have completed all this treatment, so we know that our next level of care is going to be a recall. So we're going to highlight 6-month recall and hit OK, and I'm going to put my initials there. And then this goes away, which is great. As long as this box is active, as you saw, I can't make any other changes here. So that's important as well when we get in there, to try to complete that note as quickly as possible, or at least start the note so that you can finish it before somebody asks you to do something else to the chart, because you just clearly won't be able to do that. This is the result of our note here. You can see repeated or reported to the visit today with Dad. Verified that the consent form was signed. Why were they here? They were here for treatment for decay. We used 50% nitrous for the local anesthetic administration. Super topical was placed. 0 cartridges of Lido, half a cartridge of articaine, and then 30% nitrous was used for the remaining treatment. Following teeth were restored, and you remember entering all that information. Here it is. Here's an interesting scenario. There's a space here between number 19. I can just eliminate that just as quickly as I want to, and there was no hashtag in front of 27, so I could just alter the note once it's done there to make it perfect. Now everything's lined up, looks great, no problem. I could even eliminate this space so it is dead on perfect like that. The point being that you can, once this template is finished, you can go back and alter it so it's exactly what you want it to say. If there's repetitive things that are, again, done time and time again, that's where a template comes in. Little nuances here and there that need to be made, again, are made after the note in this section in exactly the way that we just demonstrated. So 100% oxygen was used for 7 minutes. Important postoperative instructions were provided verbally and in written form to Dad. Behavior 4, and in parentheses, very good boy. You remember entering that as an option there for the operative note. If nothing was entered, then there's just 2 parentheses, and probably a good idea just to highlight that and then delete it. Next visit, 6-month recall, and then my initials. I'm going to go ahead and lower this bar a little bit here to make the tooth chart a little bit bigger. The final thing that we need to do, which is done kind of at any point along the procedure, is to go back and then highlight the procedures and make sure that they are complete. So again, highlighting the procedures this way, right mouse clicking, and then set complete. Everything turns blue, there's no more red. The red disappears from the area. And let's go back briefly then to the clinical notes and see what that did here. That should have produced, should have produced in the notes all the procedures that are completed. And so a little bit of redundancy there, of course, here, but still, it's okay. We're going with the system. It's okay to have too much information versus too little. So I hope that's clear to everybody. And of course, if there's additional questions, don't hesitate to ask a team member, Dr. Culp, or whoever may be available. Our next note is going to be emergency care. We're going to start with a new note here. Close the operative section and go open the emergency care here. We document all of our emergency cares with what's called a SOAP note, which is kind of a standard old school note here, but it does provide and have the ability to ask all the appropriate questions relative to an injury, so, or actually any visit for that matter. We're going to double click on the SOAP note, and again, parents are who is accompanying our kids, paramount. In this case, it's going to be mom. And the S of the SOAP note stands for the subjective findings. This is what happened to the patient in either the parents' or the child's own words. For example, I was riding my bike and fell off and broke my front tooth. Okay, and it's just that simple. That's, almost a quotation of what the child said. You hit OK. The O is the objective findings. These are not whimsical. These are the actual findings that you find, and there's a number of different methods by which you find them. The first is observation. What does the child look like? Do they have traumatized lips? Do they have lacerations? Are they bleeding from their gum tissue? Do they have bruised gum tissue? Did they lose or break portions of their tooth off? If they did, how severe is it? Is it a fracture into the nerve tissue? How much pain are they in? What causes their pain to be elicited? Also, radiographic findings or x-ray findings are documented here. We typically take a radiograph. Dr. Culp will describe what he sees, and then on the laminate you would simply document that and then fill that section in here. So these are the facts, the observational facts in relationship to the injury itself. So I'm not going to fill all those in, but that's where this goes. The A is the assessment. What exactly are we looking at here? Are we talking about a class 2 Ellis crown fracture, uncomplicated? Are we talking about a simple laceration that needs no additional care except for follow-up? What is the diagnosis? And once you've documented that according to what Dr. Culp says, then you go to the final, which is the P. The P in the SOAP stands for the plan. What are we going to do given our circumstances of this injury? And it's as varied as the injuries are coming through the door. So documentation of that is very important, of course. And then the appropriate follow-up will manage the situation correctly. Then the initials go there, and of course I'm putting my initials here, but your initials would also be there as the dental assistant, being appropriate to fill this in so that we have all the people involved with the care of that individual are indicated in this box. And then again, what's the plan? We have evaluations, we have recalls, we have whatever we need to have here. So in this case, you can see how it lists out the plan and the note. You would obviously have a lot more detail in this section here. And I clicked the 3-month reeval of the situation on purpose because it's obviously not a complete sentence here. The plan there of a 3-month reevaluation of, in this case, let's just choose 8 and 9, assuming that they injured their top front center teeth there, is what the plan is. In this case, also you can put behavior, Frankel 4, and the plan in this SOAP note is equivalent to the next visit, so there's no redundancy there at all. We're going to go ahead and describe another aspect of notation or note-taking here in the chart. We do take care of a number of younger kids, and we use what's called conscious sedation for that care. When they first present, there's a series of documentations to verify that they haven't had anything to eat or drink from midnight the night before. We document their weight, a number of other things before we medicate the child. And that note is under the operative section, and it's listed as DNV, which stands for Demerol and Visceral Check-In. We're going to select that and double-click and just go through that process here. Did we update the medical history? Yes. See patient's chart. That's a prompt to look up in the Red Cross. If it's red, of course, and we're not in this template, you should be able to click that and demonstrate exactly what the health concerns are, if any, for this child. But yes, the answer is have you updated medical history? Yes. See patient's chart. The patient's weight. You can do 35 hashtag, which is 35 pounds. ASA rating is American Society of Anesthesiology. Basically, healthy kids don't have any medical problems to speak of are at ASA 1. An ASA 2 is somebody who, for example, is asthmatic but under control, under treatment, and we would never treat an ASA 3 individual. So it's either 1 or 2. If they have a medical condition, they're ASA 2, that's stable, like I said, a heart murmur, asthma, that kind of thing. But we usually find that kids are ASA 1s. Click OK. What time did the patient last eat or drink? We'll just put 9 p.m. last night. How much Demerol is provided? 35 pounds. Dr. Culp would then prescribe 35 milligrams. And again, this is asking specifically for Demerol. If we hit OK, and then when was the med given? Very important. Let's say 7:05 a.m. And that's important later so that we can track that and know when to start the patient. What's the dose of Narcan? Narcan is a reversal agent for Demerol specifically, or meperidine is the generic name for that. On the inside of the cupboard directly above the computer in the sterilization area, there is a chart that demonstrates, based upon the patient's weight, what the appropriate dose of Narcan is. So I'm not in front of that particular chart at the moment, but I'm just going to go ahead and say 0.3 cc's. I don't know if that's correct or not, but it's obviously, this is for demonstration purposes only. Hit OK. We also want a predetermined maximum dose of lidocaine, and that is also listed on the inside cupboard of the cabinet immediately above the computer in the sterilization area. And based upon the patient's weight, you can list max cartridges. We're going to call it, again, 1.5. I don't know if that's right, but it doesn't matter for this demonstration. And then the same thing for the articaine. Let's say 1.2 cartridges for that. And then again, let's just eliminate this part of the note so things are more clear. This is what would come up in the note here. Did you check medical history? Yes. See patient's chart. Patient's weight 35 pounds, ASA 1, last ate or drank 9 p.m. last night. Based upon their weight, 35 milligrams of iperidine, and there's always 25 milligrams of Visceral provided. This is the time, important to track. Narcan dose is predetermined. Max lidocaine dose, max articaine doses are right here. This patient is ready to be medicated, and they will continue with their process there. You keep this note open to then have the ability, once the treatment is rendered, over here you would probably hit combinations, because sedation patients are typically combinations of different styles of treatment, whether it be resins, amalgams, pulpotomies and crowns, or extractions. So we have this here so that we can customize the operative note and minimize redundancy and improve our accuracy. So hope that's clear to everybody. Again, if there's questions about that, please don't hesitate to ask them. We're going to continue our note taking here on as it relates from the dental assistant in the back, from a hygiene perspective. Our hygiene notes are listed over here. There's a couple of different options. We have a prophy fluoride section, which we'll see some kids at, say, 3 years of age. We're not quite sure if they're ready to have their teeth cleaned, whether they even need to have their teeth cleaned, and then, of course, whether they would tolerate it or not. If we do find that they do need a cleaning and they would tolerate it, we have them come back after the new patient exam, and we do what's called a prophy fluoride. So that is a very abbreviated visit. It's simply a cleaning, and this template gives an opportunity for all the appropriate documentation as to how their hygiene was and what we did and things like that here. So that prophy fluoride visit is covered in this section anyway, so we're just going to go ahead and skip that, but I just wanted everybody to know specifically why this is in here, and we're going to close that for now. When a patient arrives for a hygiene visit, they have obviously been seen before, and then some 3 sections here that need to be filled out for a hygiene recall visit, specifically when Dr. Culp is in the office. A final twist to that would be a JRC type visit where the hygienist is doing obviously the cleaning and some preliminary examination work, and then Dr. Culp will go back and review all that information. So that's where the JRC comes in. We're going to stick with a standard recall to begin with, and when the patient arrives, you would have this this first template taken care of. So we're going to go ahead and open it up again. Who do they come with? In this case, we're going to say grandparent. Any concerns? We want to be sure that as part of our customer service that if they do have concerns, we want to be sure to have those questions answered in no uncertain terms, definitively taken care of, because they took time out to answer or to ask those questions. So in this case, this patient has no concerns. Additional comments, that would be something that you would need some free text for on a situation that would be sort of specialized. In this case, there are no special comments necessary, but again, this box pops up for customization of the note in any way that you see fit. X-rays, yeah, we're going to take 2 bite wings. There they are. Do we update the medical history? Yes, we did. All prescribed X-rays were taken. If not, say they were in orthodontics, we need to take X-rays, but we can't take them because they have orthodontic hardware in place. You would have already told that in the previous screens that x-rays are indicated but unable to obtain, which is what UTO stands for, x-rays due to orthodontics. Sometimes we can't get them because of a lack of cooperation, gag reflex. Sometimes moms and dads can't afford them, or lack of insurance coverage, or all these other, appropriate situations down here. But in this case, we did get them. And that's the initial note. Now the hygienist would then start to clean the child's teeth, get things going, and when the dental assistant, that is the assistant dedicated to assisting the hygienist at that particular day, they would then gather some additional information. So from the assistant's perspective, the next series of questions are related to the hygienist's observations of the status of the child in the chair. So the moment they get in the chair, they probably have not had an opportunity to assess the circumstances yet. So it's a good idea from the assistant's perspective to simply provide an opportunity for the hygienist to get a feel for who she's working with today. Call it 5 minutes of time. And during that 5 minutes, they're very good at getting all of the assessments sort of solidified in their mind. They know the questions inside and out. So then it's an opportunity when you have that time to know, as the assistant, that the next portion of this note needs to be filled out, which is the recall portion of hygiene exam. This is what the hygienist does for you. So you simply open that up, and they're here today for, in this case, we're going to call it an adult prophy. And we're going to do some adult fluoride as well. FL minus is fluoride, and of course the foam is the standard. We do use varnish from time to time as well. Patient's oral hygiene is assessed by the hygienist. In this case, it was only fair. We want to avoid also using the word poor. So if the child's hygiene is an F as far as a numeric or a letter grade there, you can use the word F. OH was F. Or OH was P, but I want to avoid the use poor. The word poor, chair side, it just doesn't have a very good connotation, but we do want to provide that level of information to me as we're conducting the examination together, so I have the information correctly in my mind, and then I can talk to the parent accordingly. So, was plaque present? Yes or no? If it was, what was the quantity? And in this case, we're going to choose moderate. Where was the plaque? We're going to say upper and lower anteriors, facial. And then we're going to go next thing. Was there calc present? In this case, no. Where was it located? Well, if there wasn't any, obviously just leave this blank. Was there stain? Yes, light. And in this case, we would put generalized, or whatever's appropriate. Whatever the hygienist says is what we put in here. OHI is oral hygiene instruction provided. Add as necessary. They will tell you, the hygienist will say, I stress the hygiene with the parent and patient. I want them to focus on gum line brushing. And I want them to avoid sticky candy, juice, and soda consumption. Was the Cavitron used? Well, there's no tartar, so in this case, no. Periodiagnosis, healthy. Typically, we'd have like a generalized mild gingivitis, but again, this diagnosis here is going to be provided by the hygienist. You just simply check the box that is appropriate based upon what she says. Frankel score, good kid. Additional comments, whatever you feel you need to put here to complete the note. And here is the assessment. So now we have the initial assessment here of getting the patient started, and then subsequently, what is the status of this patient as they're in your chair today. And then the final is, of course, when I come into the room, we have the doctor exam. So we're going to bring that up now. Does the patient have decay? Well, they may have decalcifications, which are incipiencies, and that would be, either decalcifications would be the outside of the facial aspects of the upper anterior teeth, We'd also have incipiencies, which are in between the tooth cavities but not treatable, or treatable areas are defined or identified and definitely on the way to being fixed. So whatever's appropriate in this situation. Was a pano taken? Yes or no? In this case, no. If the pano was taken, or not taken, I'm sorry, and this is a standard document here, we don't want to say anything in this box because it won't look right in the note. And I'm going to just leave it here so you can see why it's appropriate to zip this out before you advance. So I'm going to leave it here on purpose, and we'll see what it looks like in just a second. Are we referring to anybody? Yeah, let's refer to Dr. Daniluk in this case. And when we do, of course, we want to make sure, once that's done, and once this note is taken care of, that we go up to the referral section and make sure that it's definitely demonstrates that, which will help us track that material or the information in the future. Why are we referring? Most commonly, we have ectopic canines on the upper, but it could be crowding, it could be a cross bite, it could be a class 3 bite, whatever it is, but we document that. Items to monitor, that might be excuse me, third molar position, incipiencies, whatever. But in this case, we're going to say none. What's the caries risk for this individual? We're going to say moderate. And what's the plan? Well, they didn't have any treatment, so we're going to select a 6-month recall as their next visit. And all the other possibilities are listed here as well. How many units that we need for their cleaning next time? A standard is 2 units for somebody without orthodontics and reasonable hygiene. 3 units is a standard orthodontic patient, and there could be other factors here. But the hygiene are the obviously units assigned for hygiene, where no doctor time is assigned there. And then this template is also, or this section of this template is used for other aspects or other notes that are here, and that's why these are here as well. These are doctor time notes here. So I'm going to go ahead and select a regular recall time frame for this individual. And then, of course, the initials, and here is the note. Going down here, the assessment, decalcified areas are noted, incipient areas of decay are noted and identified and noted in the patient's chart. Here's what I wanted to show you. No pano taken, pano is within normal limits. Clearly that doesn't make any sense at all. So if you remember that window that were there, this is going to be a standard document or standard default as to what's listed in that box. Just simply highlight it, hit the delete key prior to the box being advanced by hitting the OK button, and no pano taken will be the only thing that's listed here. So referrals, orthodontist, Dr. Daniluk. This is interesting here. It seems like it's done it twice. That's not really sure what that is. I'll have to look into that. Items to monitor is none. Caries risk assessment, moderate. And our standard line for talking about our oral hygiene instruction, etc. What's our next visit? Well, here it is. We have it ready to go. So hope that's clear to everybody. The hygienists or the assistants on the hygiene side do have a bit more to kind of balance or maintain as far as the schedule is concerned. There's a lot of different things going on. You're maintaining a balance of your time between people that are coming in the door and people that are currently in the chair. There's lots of management of time necessary for that. So it's a very specialized position. The note taking here is pretty straightforward, and most people get it very, very quickly. So again, if there's any questions, please ask an appropriate team member.